I welcome you all to today's session. Myself, Rajita, and I am here again with a new topic to discuss. So, today we should learn regarding the role and responsibility of the nurse in intensive care unit. So, critical care unit or intensive care unit is basically a specialized unit that is present in a hospital setup in order to provide medical and nursing care or specialized medical and nursing care to the client who are critically ill or having a life threatening scenario. So basically, the critical care unit meets the special need of a particular client who is suffering from a critically ill disease. Now, also, we will be learning about that in a hospital setup, there will be development of rapid response team. Now, this team is nothing but a collaborative team of the medical professionals who will be working inside the hospital setup mainly to the critical or intensive care unit in order to provide the specialized care to the client. Now, the team members who are often involved to provide the specialized and advanced care include a critical care nurse, respiratory therapist, critical care physician or intensivist, as well as special practitioners or advanced practitioners of nurse. So definitely the early interventions in a critical care unit helps to reduce the morbidity and mortality for each and every client. So that is the reason why a proper response team should be always developed inside the healthcare setup and who will be dealing with the critically or emergent condition of the client in intensive care unit. So as we have discussed the basic information regarding intensive care unit, so I hope you are completely aware now that it is a specialized setup where a critically ill patient will be taken care of. Now we should learn about the definition of critical care. So in precise, the critical care, basically the term itself is suggesting that it is the provided care or the care which will be provided to the client basically who are clinically unstable or potential instability is present for them. So basically it will be always compromised with certain specialized medical and nursing care. We are going to see what is the role and responsibility of the nurses here next in order to provide this specialized care to the client. Now we should discuss regarding the critical care unit. So the definition of critical care unit suggests that it is defined as the particular specialized unit in which the special clinically unstable or potential clinically unstable client are taken care of by the highly specialized nurses and doctors or physicians. So now let us discuss the definition of critical care client. So Association of Critical Care Nurse have defined the critical care client as a critically ill patient as one who is having a high risk for actual or potential life-threatening health problem and who requires a intense and vigilant continuous monitoring. So I hope you are completely clear that this patient or who are critically ill will be always having a potential or actual life threatening condition or disease condition. Now they definitely require a very specialized care as well as a very intensive and vigilant care, even they need a continuous monitoring. So critically ill patient often will be physiologically unstable and who will be requiring advanced clinical judgment by the physicians as well as by the nurses. Patient in critical care unit will be having very severe condition developed or maybe they're having an increased high risk for the development of complication associated with the disease condition. That is the reason why this critically ill patient require a frequent assessment as well as a very often they require intensive and invasive technique to manage their health condition. Even the critically ill client in a critical care unit may require a intensive and a complicated nursing care and nursing procedures, which will be related to the use of intravenous polypharmacy, even certain advanced technology or advanced life support in order to manage their life threatening conditions. So that is the reason why a nurse who will be working in an intensive care unit should be very vigilant enough and should be well aware regarding the usage of highly advanced technology to save the health of our individual. Now we are going to learn the definition of critical care nursing. So the critical care nursing is defined as a specialized nursing care which will be provided to the critically ill patient from the time of injury or disease development until they're getting discharged from a critical care unit. So, this nursing care or the specialized nursing care would be started from the time when the person is developed with a life threatening condition, and it will be ending once the client is getting discharged from the ICU or intensive care unit, or the client is having a promotion of their health condition. So that is how we are going to see the critical care nurses would be playing a very vital role in order to take care of critically ill patient in intensive care unit. Also, we can say that critical care nurses will be always deals with the human response towards the trauma or a life-threatening scenario. That is the reason why here a nurse should be having a well-aware knowledge regarding the human response towards any trauma or any life-threatening scenario. And they also should be knowledgeable enough to manage the client in an emergent condition. Now we are going to discuss regarding certain advanced technology which are often used to manage the client in a critical care unit. So often we are going to see the use of ECG monitoring or electrocardiography monitoring in a critical care unit for a continuous term. That is the reason here the nurse have to have a wide knowledge regarding the usage of electrocardiogram in order to make sure that they are identifying or they're using this particular technique in a proper way to manage the client condition. The next is often we are going to see the usage of arterial line here. So the patient who is admitted to the critical care unit, most of the patient will be often having the arterial line in them. So it is a nurse's role to learn about the arterial line placement, even the management of it. So that's how the nurse would be able to serve the client who are having or who are present with the arterial line. Also, we are going to see most of the client who will be admitted to a critical care unit, if they are compromised with their respiratory and circulatory status or system, we are going to see the usage of ventilator. Hence, the critical care nurses should be well aware about the usage, the mode, and the procedures to use the ventilator in an effective way. For some patient in critical care unit, even intracranial pressure monitoring would be done. So it is a nurse's role to know about the process or the procedure related to the intracranial pressure monitoring. Even we will be able to see the usage of pulmonary artery catheter, even intra-atrial balloon pump therapy would be always or almost always will be done for the client who are admitted in a critical care unit, depending on their condition or depending on their disease condition. So that is the reason why nurses should learn the usage of all these techniques or all this advanced technology in order to serve better. So you need to understand in critical care units, not only the critical care nurses would be present to manage the client, but basically it requires a multidisciplinary team approach in order to provide a effective medical and nursing care to the client. That is the reason we are going to see multidisciplinary team will be present in a critical care unit. This includes the medical and nursing directors who will be basically involved in the management of the functional ability of the intensive care unit, or in simple term we can say the medical and nursing directors will be present who will be managing the function inside the intensive care unit. Next, we are going to see the use, there will be presence of a team of medical professionals inside the intensive care unit, which basically involves the presence of physician, intensivist, respiratory therapist, even the nurses and counselor. So that's how a whole medical professionals team will be providing the necessary care to the client who are critically ill. So, in intensive care unit, a nurse should also use the standard protocols and their ethics and values of the hospitals. So that is how using of standard procedures and protocols would help the multidisciplinary team to provide a high quality medical care and nursing care to the critically ill client in intensive care unit. So as we have learned that basically an intensive care unit often would be involving a multidisciplinary team approach. So here nurses plays a very important role as a collaborator and as a communicator. So nurses would be the first person who would be having a direct contact with the patient often and in a continuous manner. So that is the reason why a nurse would be responsible to communicate with all other health professionals regarding the patient need of care, as well as they will be also responsible to communicate with the patient caregiver or family members. Even the nurse here would be playing a collaborative role who will be basically working in a collaboration with all other health team members in intensive care unit in order to provide a very high quality critical care or medical care towards the critically ill client. So next we are going to learn regarding the critical care practice pattern. Now you have to remember the critical care practice pattern is basically divided into three different categories. The first one is open intensive care unit or open critical care institution. The next one is closed critical care unit. And third one is the transitional critical care unit. So we are going to read about first regarding the open critical care unit. So in open critical care unit, we are going to see a physicians or under a physicians, a patient will be getting admitted inside the intensive care unit for continuous treatment procedure. Now here, not always the intensivist will be involved into the admission procedure of the client. Client will be generally referred from a physician directly. But here in open critical care unit, we are going to see the presence of intensivist will be there if there is any need of the client. So here we are going to see in closed critical care unit, a client will be admitted directly under the intensivist. So intensivist or medical professionals will be specifically there inside a critical care in order to provide a continuous treatment to the client here in closed critical care unit. Whereas in transitional unit, we are going to see the clients will be admitted into the critical care unit where they will be having or they will be presence of personal physician as well as an intensivist for a prolonged term or for a long duration in order to provide care to the client or in order to provide medical care to the client. So that is how the critical care unit pattern divides into three, that is open, closed and transitional. So in open we have seen there will not be presence of intensivist always. Whenever the need is there, only the intensivist will be available. Whereas in closed critical care we will be seeing the involvement of intensivist in the treatment procedure in a very depth way, or always the intensivist will be present to provide the care to the critical ill patient. Whereas in transitional type of critical care unit, we are going to see the clients will be present with physicians or personal physicians as well as intensivists. So now here we are going to learn regarding certain intensive care unit model. So the first and the most common model of intensive care unit is full-time intensivist model. So here the patient will be admitted to the intensive care unit, and almost always our intensivist will be available to take care of the client. The next model is consultant intensivist model. Here the intensivist will be communicating and collaborating with our other physician. Those physicians would be preferably providing the care or will be providing the care to the client in order to manage their symptoms. So first we have seen the full-time intensivist. The client will be completely or directly under the intensivist and will be getting the medical care from directly to the intensivist. So in full-time intensivist model, we have seen there will be presence of a full-time intensivist. Under them the client will be admitted and they will be getting a continuous treatment from them. Whereas in consultant intensivist model, we have seen the intensivist will be collaborating with another physician who would be providing the medical care continuously to the client who is admitted in intensive care unit. Next, we are going to learn about the multiple consultant model. Here, multiple physicians or multiple specialized physician would be present in the intensive care unit who will be deciding the treatment procedure for each and every client who are admitted into intensive care unit. Next, we are going to learn about the single physician model of intensive care unit. Here, only one physician would be present and they will be providing direct care to the client depending on their need. So I hope till here you have learned how the intensive care unit generally works. So we have seen certain patterns, even certain models, how the intensive care unit generally works, right, to provide the care to the client. Now we are going to learn regarding the common conditions which often requires the admission of the client into an intensive care unit. So this basically includes any one condition which is causing a life-threatening scenario for the client. Now, life-threatening scenario can be actually present, or maybe it can be a potential life-threatening scenario where the client would be often transferred to the critical care unit in order to have a highly specialized assessment and client monitor. Next, we are going to see the patient often who are present with acute respiratory failure, acute myocardial infarction, also considered the indication for the admission into the critical care unit for the client. The next condition which often requires a critical care unit stay include a cardiac tamponade, even a shock. Heart block or the patient with heart block often require the admission to the intensive care unit so that a continuous monitoring can be done for the client. Organ dysfunctions also considered is one of the most important indicator for admission into intensive care unit. Severe burns, which is causing a life-threatening scenario, often requires an intensive care unit admission. Also, receiving the surgery or the person who are receiving a major procedure or major surgical procedure, for example, organ transplant or maybe a liver transplant, they definitely requires the admission into intensive care unit. Because remember, a major surgery, whenever it is done to the client requires a very specialized and continuous monitoring. That is the reason they need to get admitted to the ICU or intensive care unit. Medical emergency like acute sepsis, diabetic ketoacidosis, drug overdosage, even thyroid crisis often require the client to transfer into intensive care unit for a specialized care. So as we have learned the conditions which is often indicating that the client need an intensive care unit stay, we have seen, right? So now we are going to discuss regarding the common problems which are basically present for the critical care client who are getting admitted into an intensive care unit. Now, the common problem among most of the clients who are present in intensive care unit is the pain and anxiety. Majority of the client will be present with certain disease condition which will be causing often severe pain for the client, as well as the patient or the client will be almost always anxious when admitted into intensive care unit. The next problem is often the client will be present or the client can present in a critical care unit with a altered level of consciousness, even they will be not oriented towards the environment. Nutritional deficiency or altered nutrition status, even alteration of the intake and output is very common among those clients who are admitted to a critical care unit. Because you have to remember, most of the client will be having severely progressed disease condition, right, which will be alternating their intake of diet and fluid. That is the reason here the nutritional alteration and the fluid electrolyte imbalance is very commonly seen among the client in intensive care unit. Sleep irregularity also is a very common feature which is being seen or which has been noted often for those clients who are admitted in critical care unit. Now, it can be because of the severely progressed state of the disease, or maybe the discomfort, or maybe it can be related to the anxiety that the client is having after admitted to the intensive care unit. Discomfort will be almost always will be complained by each and every client who will be present or who will be admitted in intensive care unit. Inactivity is one of the major common problem among those clients who are present in intensive care unit. It is because majority of the client will be having restricted movement. That is the reason here the inactivity also considered to be one of the major problem among the client who are present in critical care unit. The next problem which is often seen and very major and important problem among the critical care patient is infection. So almost always the client here will be immunocompromised, or else they will be having increased or severely progressed disease condition. Even sometimes the client will be present in the critical care unit after the surgical process, so they will be present with incision. So that is the reason infection or chances of the development of infection is very common in intensive care unit. So as we have learned regarding the general problems which are often found out among the client, now we should learn about the classification of critical care units. Now, the first one classification or the first classification of critical care unit is termed as the level 1 critical care unit. Here, the specialized physicians or intensivist, even the critical care nurses, will be providing a continuous monitoring, a continuous specialized observation, even short term ventilation to the client in order to manage their conditions. Now, in level 1 critical care unit, the client will not be having very severely progressed disease condition or very severe life-threatening condition. Generally, in level 1 critical care unit, the nurse and client ratio would be 1:3, and not always the intensivist will be present or will be available in the level 1 critical care unit, because here the intensivist only needed when there is emergency need is present in this kind of unit. So in the level 1, we are going to see, compared to the other level of critical care unit, less complicated patient will be present in case of level 1 critical care unit. Next, we are going to learn about the level 2 critical care unit. So in level 2 critical care unit generally provides a very specialized observation and a continuous monitoring to the client. Even the client who are generally admitted to the level 2 intensive care unit often need a long-term ventilation. Now, level 2 critical care unit will be almost always involved with a presence of resident physician. The nurse patient ratio here would be 1:2. Even the respiratory therapist will almost always will be available in level 2 critical care unit. So here in this level 2 critical care unit, almost always a consultant doctor will be available to provide a effective and high quality medical care to the client. Next, we are going to see the level 3 critical care unit, which provides all aspects of intensive care to the client who are having a very severely progressed condition or severe life-threatening condition. The intensive care also include a invasive hemodynamic monitoring for the client. Even dialysis also is used often in level 3 critical care unit. Here, the nurse patient ratio will be almost always 1:1 because here the patient will be having or will be present with a very severely progressed disease condition. That is the reason a specialized nurse here is required specifically for each and every client to take care of their need. Often the physicians also will be present or residents doctor will be almost always available in level 3 critical care unit. So as we have learned regarding this particular 3 level of critical care, now we should learn regarding which type of care would be often provided to those clients who are present in different level of critical care unit. So basically level 0 critical care unit is termed where the normal ward care would be provided to the client. Here the client will be almost always present with less complicated disease condition or less complicated condition. So here only the ward care or the care would be provided to the client depending on their need. So in level 1 we will be almost always seeing the client will be admitted here who will be at risk of deterioration for their health. That is the reason the critical care team should support the client in order to manage their condition in level 1. In level 2, we will be almost always seeing that more observation and the continuous specialized monitoring and assessment is needed here. Even the client almost always who are present in level 3 will be having organ dysfunction, one or more. Even the post-operative client can be present here. That is the reason more specialized monitoring and treatment is needed here in level 3. Even invasive technique also can be used to manage the client who are admitted in level 3 critical care. Now we are going to see in the next level, which is level 3, basically needs a advanced respiratory support and a basic respiratory support. So often the client who are present in this level of critical care, we will be seeing the client is facing or client will be present with a severely progressed disease condition and alteration in the respiratory and circulatory function. That is the reason advanced respiratory support or a ventilator support will be often needed for the client who are admitted in level 3 critical care. For this client, often the multi-organ failure can be present. So that is the reason high specialized medical and nursing care is needed in level 3 critical care. So now we would be learning regarding certain types of critical care unit. So first type of critical care unit is neonatal intensive care unit. So as the name itself is suggesting, the neonates will be taken care here in this intensive care unit who are having a severely progressed disease condition in the early life. Next is pediatric intensive care unit. So this specialized intensive care unit will be providing the care or medical and nursing care to the pediatric group. Psychiatry intensive care unit will be almost always present. So basically they will be dealing with the psychiatric patient who are having a very acute and severely disease progression. Next, we are also going to see the intensive care unit can be termed as coronary care unit. where basically the cardiac conditions or the conditions which often includes the coronary artery disease or maybe the myocardial infarction, mainly the disease condition related to the cardiovascular system, will be managed in this kind of specialized intensive care unit. Even there can be presence of medical intensive care unit, even surgical intensive care unit. So medical intensive care unit would be basically providing the medical care the to those clients who doesn't require a surgical method, or the client who have not undergone a surgery recently. Whereas in surgical intensive care unit, we will be going to see that basically here the client will be brought from the operation theater to manage or to provide the care which is needed after the post surgery period. Even we are going to see there can be presence of neuro trauma intensive care unit, which almost always will be dealing with any traumatic injury or any neurological conditions. Neuro intensive care unit can be also present here. Often the patient will be present with certain neurological disorder or dysfunction. Burn intensive care unit is a type of specialized intensive care unit which will be almost always dealing with the client who are having severe burn. Respiratory intensive care unit almost always will be dealing with those clients who are having respiratory disorders and the severely progressed respiratory condition or maybe the respiratory failure. The next type of intensive care unit is geriatric intensive care unit, which will be often dealing with the client who are under a geriatric group. So generally the medical and surgical intensive care unit, we call it as general critical care or general intensive care unit. Whereas the specialized intensive care unit will be often indicating the unit like neonatal intensive care unit, pediatric intensive care unit, or maybe neurological intensive care unit, cardiac intensive care unit, or a burn intensive care unit, and so on. So now we are going to read regarding nurses' role and responsibilities in critical care unit. So the first and foremost responsibility or role of a nurse is the nursing assessment. So whenever a critical care nurse is present in a unit, it is solely a nurse's role to assess holistically the need of the client who are admitted in this critical care unit. So the nursing assessment involve certain components. So those components are, first one is nursing history collection. So often a specialized nurse in critical care unit would be doing a thorough history collection. This basically helps the nurse to build a rapport with the client and with their caregiver in an initial phase, which will be ultimately improving the quality of medical and nursing care in intensive care unit. Now, the history collection often includes the data related to the health status of the client, their present and past medical history, their present and past surgical history, even their lifestyle, their daily habits. Psychological and social data also should be collected by the client. So, regarding their perception towards the illness, their socio-cultural background, their practices, their cultural beliefs also should be noted here by the nurse from the client. Soon after performing the history collection, a nurse should perform a physical examination. So physical examination often includes a head-to-toe examination and a specific system examination. So physical examination would be basically involving the steps like inspection, palpation, percussion, and auscultation. So as we have learned here that the physical examination definitely would be done by this four step. And here our nurses would be definitely identify all the signs and symptoms that are present for the client. They will be also noted down if there is any sign and symptoms is present for the client, which is indicating or which is useful in the treatment procedure for the particular client. Now, next step is the documentation of the assessment. So here nurses plays a very important role to document all the findings, even the collected data while doing the history collection. Documentation plays a very important role because it basically helps the nurse to communicate about the patient need and patient sign and symptoms that is being present to the other healthcare professionals. So this actually helps the nurse to properly plan the medical and nursing care. It also helps the nurse to communicate with the physician so that they can provide effective and quality nursing or quality medical care to the client in order to manage their condition. So as we have learned that nursing assessment, so you have to remember through this nursing assessment, a nurse would be setting some goals for each and every client, and depending on that they will be also selecting certain interventions and they will be implementing it. Even it is a nurse's role to evaluate the feedback from the client after providing the medical and nursing care. Often nurses here in critical care unit would be involving the client as well as to the family member in the planning of the nursing and medical care for the particular individual who is admitted in intensive care unit. So next we are going to learn regarding the principles of critical care nursing. So the first principle is anticipating. So as you know, being a critical care nurse, it is very important role of a nurse to anticipate the scenario for the client. So anticipation helps a nurse to identify the high risk that is or that may can occur for the client. Even they will be trying to identify the high risk or complication development for each and every individual in this phase. So anticipation helps the nurse to get ready for the meeting the need in any emergent condition. And also the anticipation of a nurse helps the whole medical team to save the life of a client. The next principle is early detection and prompt action. So as we have learned, mostly the patient often will be admitted to the intensive care unit with a severely progressed or life-threatening disease condition. So it is a nurse's role to diagnose early or to detect early any presence of initial sign and symptoms which is considered to be the indicator for any complication development. Detection of the sign and symptoms initially and prompt action by the nurse is very helpful to manage the client at an early stage and prevention of the complication formation for the client. It basically helps the nurse and the whole medical team to save the life of a client in a clinical setup. Next, we are going to see the third principle, which includes the collaborative care or the collaborative practice. So as we have learned, intensive care unit needs a multidisciplinary team approach in order to provide high quality medical and nursing care. So it is a nurse's role to collaborate with each and every professionals or team member in an intensive care unit in order to improve the quality of medical care and nursing care for the client. The next one is communication. So as we have learned that the nurse should be a very good communicator in order to maintain a communication between the patient, their caregiver and family member, as well as physician and every team members of the health team or multidisciplinary team inside the intensive care unit. Nurses would be one who will be assessing the need of the client and who will be advocating for the client's need. Communication about the medical care and nursing care which has been provided or which has been planned also plays a very important role here to manage the client. The next principle is prevention of infection. So as we have learned that almost always the client will be having immunocompromised state or severely progressed disease condition inside intensive care unit. This is the reason why the preventive measures play here a very important role in order to control the infection within the clinical setup. So here nurses plays a very important role to manage or to maintain the aseptic technique. They will be also maintaining the attire or aseptic attire if needed. Isolation of the client should be done by the nurse if the client is having a immunocompromised state or a probable condition which may consider to be transmitted, or a transmitted disease condition or infection condition which can be transmitted to the other person. So isolation here helps or plays a very important role to maintain or to prevent the infection spread. Crisis interventions and the stress reduction is the next principle for the nurses who are working in critical care unit. So basically here the crisis interventions will be done by the nurse in order to save the client's life. Even here, the dignity and the confidentiality of the client's information will be ensured by the nurse. It basically helps to improve the bonding between the client, the nurse, as well as their caregivers. So definitely here, stress reduction also plays a very important role to manage the client and for their early recovery. So nurses plays here a very important role. That is the reason nurses will be acting as a patient advocate who will be basically helps the person or helps the individual who are seeking the treatment in intensive care unit for their need and for their preferences regarding the medical and nursing care. So this definitely helps a client to improve for their health, and also helps a client to achieve a early recovery from the disease condition. Now, the factors which are often related to the critical care nursing are intra and interpersonal factors, technical qualifications or technical knowledge, educational background, and clinical experience. So these are the factors which basically helps a nurse to be very vigilant and very specialized in order to provide a very high quality care in a critical care unit. So I hope we have learned till here regarding the principles and the factors which are considered while choosing a critical care nurse. Now we should discuss regarding the actual role of the nurse to manage the critically ill patient in a clinical setup. So the first is the history collection and physical examination, which will be often done by the nurse for the client. Ulcer prevention is also a very important role of a nurse who are admitted, or for the patient who are admitted in intensive care unit. The next role of nurse is continuous monitoring. So continuous monitoring here plays a very important role to detect the early sign and symptoms related to the complication development. Emergency equipment maintenance, or maintaining the emergency equipment or making ready the emergency trolley is very important role of a nurse in an intensive care unit to manage the condition in emergency scenarios. Efficient individual care would be provided by the nurse towards the client, as well as counseling and communication with the patient and the caregiver and family members also is a very vital and important role of a nurse in intensive care unit. Applications of policies, procedures, and maintaining the standard of the procedures and protocols should be ensured by the nurse in this clinical setup. Infection control principles should be followed by the nurse in a critical care unit. So nurse should also, or nurses would be having also a very important role to maintaining of the documentation and communication among the healthcare team members as well as the patient and their family members. So as we have learned regarding the main roles of the nurse, it is also important to provide all the bedside care to the client depending on their need. So majority of the nurse should continuously monitor the patient in order to maintain their health and prevent any complication development for the client. So the quick references protocol which will be generally used by the nurse in an emergency situation in critical care unit is quickly reviewing the patient. The first step would be followed as a quickly reviewing the patient. So identification of the client and their need of the client, their history and physical examination would be done by the nurses. Maintenance of airway, breathing and circulation should be ensured here by the nurses in an emergency situation for the client. Introduce the intravenous line or a central venous line also would be done by the nurse if there is need of the client. So nurses plays a very important role to be with the client and ask for their need, as well as the psychological support would be always provided to the client in emergent condition by the nurses. Cardiac monitoring or making sure that the client is completely getting a emergent procedure should be definitely ensured by the nurses. So here in emergency situation, nurses play an important role to make sure that all the emergency equipments are readily available to manage the emergent condition. Administration of medication also would be done by the nurse to the client depending on the prescription or depending on their needs and physical condition. Nurses also plays a very important role to carry on the investigations. So often the ABG analysis will be done, ECG or electrocardiogram monitoring can be done. The lab studies also may be prescribed by a physician, which will be carried out by a nurse. This basically helps to the nurse to identify the data related to the lab studies and all the monitoring that has been continuously done for the client. Also, this helps the nurse to identify any early sign and symptoms or any alteration in the physical conditions for the client, which is basically indicating development of a particular disease condition. Maintaining of a proper fluid electrolyte balance, a nutritional status, a proper output for the client, as well as a proper psychological state of the client should be ensured by the nurse. Recording the right thing at the right time also is a very important role for the nurse in critical care. The next are the consideration or the main consideration in critical care. So the first is the feeding fluid or their maintenance of their intake and output chart of the client. The next one is definitely involves providing or administration of analgesics depending on the prescription if the client is needed. So often the client who are present in intensive care unit will be suffering from a severe pain, so it is a nurse's role to administer the analgesics to them. Sedation also can be used, so maintenance of the sedation and the hemodynamic stability as well as response of the client towards the sedation also should be ensured by the nurse. Here, while the patient is in sedation, the nurses plays a very vital role to monitor the client hemodynamic stability continuously. The next consideration is using of thrombolytic agent. Even positioning of the client is also a very important consideration to provide a critical care by the nurse. Ulcer prevention and monitoring of the vital signs, glucose level and intake output chart also plays a very vital role to manage the client in critical care unit. So as we have learned, so nurses here plays a very important role to provide a nutritional support to the client. So there can be need of oral feeding or maybe nasogastric tube feeding. So it has to be ensured by the nurse that the client's nutritional level is maintained while the client is in intensive care unit. Psychological support almost always will be provided by the nurse to manage the anxiety for the client. Even the caregiver would be having a very great communication with the nurses in the intensive care unit. So psychological support also would be provided to the caregiver of the client by the nurses in order to make sure that they are providing a very high quality medical care to the client. A nurse also plays a very vital role to perform any emergent procedure if there is any need. So a nurse in critical care unit should be vigilant enough to make sure in emergency scenario they are managing with the crisis. Monitoring the client is also a very vital role here, as we have studied that a continuous monitoring by the nurse should be done to ensure effective management of the client in critical care unit. Often we are going to see the usage of specific equipments like ventilator, infusion pump, cardiac monitoring, defibrillators, ABG machines, as well as the ECG monitoring. Now, this equipment should be under control of the nurse. So it means that a nurse should have a wide knowledge about the usage of all this advanced equipments which are often used in critical care setup. So basic medications which are often administered in a critical care unit includes the aspirin, atropine, digoxin, the midazolam or lorazepam, even fentanyl, morphine, even clonidine. These are very common medications that are generally used in a critical care setup. So a nurse who is working in a clinical setup mainly to the critical care unit should be vigilant enough and should be knowledgeable enough about the dosage of the medications, the usage of it, and the indication to administer these medications. So I hope till here we have completely learned regarding the nurse's role or the activity of the nurses which often would be done by them in our intensive care unit. So remember one thing, the nurse are the one medical professionals who will be completely responsible for the continuation of the care for the client, and who will be always or almost always will be continuously monitoring the client in the intensive care unit. That is the reason the nurse in a critical care unit should be very aware and knowledgeable regarding the conditions, regarding the early sign and symptoms which is indicator of the complication development, as well as the equipments or advanced technological equipments that are often used in critical setup. Even the nurse should be knowledgeable enough to administer the medication, and they are vigilant enough to manage the crisis in case of any emergency scenario in clinical setup or mainly in a critical care unit. So I hope till here you have completely learned regarding the roles and responsibilities of the nurse in the intensive care unit. So next we are going to discuss regarding the role and responsibility of the nurse in a community setting for the next session. So thank you so much for attending the session. We'll meet you guys in the next one.